Hi friends, this is Dr. Kashish Grover, your PSM faculty at DAMS. Now I'm starting FMGE CBT PSM paper discussion. My first question is, which of the following is a category A bioterrorism? Guys, there are three categories: category A, category B and category C. Three categories of bioterrorism. Category A is the one which is most deadly and which can spread easily. So among all the given diseases, category A, this anthrax belongs to category A. Anthrax belongs to category A. Now, my next question is, which of the following under the Lakshya initiative, what aspect of maternal and newborn healthcare facilities does the program aim to improve? Guys, Lakshya initiative, under the Lakshya initiative, so Lakshya, Q, L-A-Q, Q stands for quality. So under the Lakshya, initiative, the aim is to improve the quality of labor rooms and maternal OTs. So here the correct answer is option C. Now, coming to next question. What is the recommended duration of multi-drug therapy for paucibacillary? Guys, for leprosy we have one program which is known as NLEP, National Leprosy Eradication Program. According to NLEP, the treatment for paucibacillary, the duration is 6 months. For multibacillary, the duration is 12 months. So here they are asking about paucibacillary. The best answer here is 6 months. Now, the PQLI, which of the following indicators are included in PQLI? Guys, PQLI, Physical Quality of Life Index. It includes three things. Number one, the mnemonic is ill at the age of 1 year. I stands for infant mortality rate. L stands for literacy rate. L stands for life expectancy at 1 year. So among all the given options, option A is correct. Life expectancy, literacy rate and infant mortality rate. Now, which level of disease prevention does self-breast examination primarily? Now, self-breast examination, here we are asking a woman to examine herself regularly for any kind of breast lump or any kind of mass there in her breast. She regularly, women who are at high risk of developing breast cancer, we advise them. So why we are advising? To detect the cancer early. This is known as secondary prevention. So the best answer here is secondary prevention. Self-breast examination is a form of secondary prevention. In a cohort study, alright, so they have mentioned that this is a cohort study and they want to investigate effect of dietary habit on incidence of type 2 diabetes. 3,000 participants who consume high sugar and 3,000 participants who consume low sugar were followed for 5 years. Among those who consume high sugar, 200 individuals develop. Alright, so what is incidence among exposed? 200 divided by 3000. What is incidence among non-exposed? 50 divided by 3000. They're asking about relative risk. The formula for relative risk is incidence among exposed divided by incidence among non-exposed. So here the correct answer is 4. Here the correct answer is 4. How? 200 divided by 3000 divided by 50 divided by 3000. If you solve, you will get 4. Right? Now, in a clinical trial, a clinical trial is conducted to assess the effectiveness. A clinical trial is conducted to assess the effectiveness of a new drug in lowering blood pressure. The study involves 100 participants and their blood pressure measurements before and after treatment. So guys, before and after treatment, which statistical test would you recommend? So guys, Point number 1. So this question is from test of significance. And in test of significance, first of all, we see what is the data, qualitative or quantitative. So here they are talking about blood pressure, so it is a quantitative. It is quantitative. And then we see how many number of groups. So here is only one group, which is they are doing before and after, right? That is why the correct answer here is paired t-test. That is why the correct answer here is paired t-test. Now, at what age is pentavalent vaccine typically administered to children under national immunization schedule? Guys, pentavalent is administered at 6 weeks, 10 weeks and 14 weeks. Pentavalent is given at 6, 10 and 14 weeks. So here the correct answer is option C. Here the correct answer is option C. What is the role of the logo shown in vaccination process? Guys, this logo is UVIN. You must have heard, you must have experienced CoVIN. CoVIN was a portal for COVID vaccines. After CoVIN, they launched UVIN. UVIN is basically a platform where citizens can schedule their vaccination appointments for UIP, Universal Immunization Program. जितने भी बच्चों को वैक्सीन्स लगती हैं, राइट? पहले क्या होता था, आप वैक्सीन लगवाने जाते थे, वहाँ पे you give them MCP कार्ड. आपके पास एक MCP कार्ड होता था, चाइल्ड इम्यूनाइजेशन कार्ड होता था. अब क्या करना है, आपको घर बैठे बैठे यूविन ऐप से अपना वैक्सीनेशन शेड्यूल करना है, कितने बजे बच्चे को कौन से सेंटर पे कौन सा वैक्सीन लगेगा. एंड वैक्सीन लगने के बाद इसी पोर्टल पे आपको बच्चे का इम्यूनाइजेशन शेड्यूल का जो भी उसका कार्ड है कि इस टाइम पे बच्चे को ये वैक्सीन लग गई है, वो रिकॉर्ड मिल जाएगा. सो दिस इज यूविन, यूनिवर्सल इम्यूनाइजेशन प्रोग्राम के ही जो वैक्सीन हैं ये उसके लिए है, राइट? So here the correct answer is option C. Which component is commonly found in vaccines to enhance body's immune response? Guys, in vaccine we add adjuvants. In vaccine we add adjuvants to enhance the immune response. Antibiotics is added to prevent any contamination. Preservatives are added in the vaccine to give the life. So here the best answer is adjuvants. A 5-year-old patient is diagnosed with Vivex. However, the patient has G6PD deficiency, guys. The G6PD deficiency. Which drug is contraindicated in G6PD deficiency? Primaquine. So for Vivex we give chloroquine plus we give primaquine. Chloroquine is given for 3 days. Primaquine is given for 14 days. This is for the treatment of Vivex. But if the patient is G6PD, in that case primaquine is contraindicated. If the median of data set is more than mean, so here median is more than mean. What can you infer from this data? So when mean is less than median, it is a negative skewed data. It is a negative skewed data. In negative skewed data, mean is less than median is less than mode. What about positive skew data? In a positive skew data, mean is more than median is more than mode. This happens with positive skew data. Which of the following is not a preventive measure for letharism? Guys, letharism is caused by consuming khesari dal, which contains a toxin BOA. So the preventive measures are, we can genetically modify the crop. This is true. Limiting the consumption of Lathyrus sativus, this is also true. By boiling or soaking Lathyrus sativus, this is also true. This Lathyrus sativus is the another name for Kesari dal. Kesari dal, Lathyrus sativus, same thing. But DEC is not administered for preventing lathyrism. It is administered for preventing filariasis. So C is the correct answer here. What is the strain for measles vaccines? Guys, Edmonston-Jacob is the strain for measles. This is the strain for mumps. This is the strain for Japanese encephalitis, a live vaccine. And this is the strain for BCG. And this is the strain for BCG. So the correct answer here is Edmonston-Jacob. Which of the following stages of demographic cycle is characterized by high birth rate and high death rate? Guys, stage 1 we have high birth rate and high death rate. Stage 1, which is known as high stationary, we have high birth rate and high death rate. So this is the correct answer for the question which is given to you. In early expanding, the birth rate is high and now death rate starts decreasing. In stage 3, birth rate starts decreasing and death rate further decrease. In stage 4, birth rate is low and death rate is low. So the correct answer here is option A. Which of the following is the active ingredient in the Saheli, a known hormonal contraceptive? So guys, point number 1 I want to tell you here is Saheli is the old name. The new name is Chaya. So this is a non-hormonal oral contraceptive. So guys, levonorgestrel is a hormone, ethinyl estradiol is a hormone. So the correct answer here is, yes guys, so the correct answer here is centcroman. Centcroman is the best answer here. The dose is, we give 30 mg centcroman. 30 mg is given. And this is given twice a week. That means 2 times in a week. We ask the women, take 1 dose on Monday, another dose on Wednesday or Thursday. And this she needs to do for 3 months. After 3 months, once a week is recommended. She needs to take only once a week. Which type of biomedical waste is typically disposed of in yellow bags? So guys, in yellow bags, because the yellow bag is incinerated, it is incinerated, and the infectious waste is thrown in yellow bag. What does the recommended dietary allowance refer to? Guys, see, the RDA is that nutrient, that daily nutrient intake level which is sufficient to meet requirement of 97.5% population. So here the correct answer is B. The definition of RDA is, it is that nutrient level which needs to be taken daily, for which meets the requirement of 97.5%. It is not 95%, it is 97.5%. Recent increase in NCD is example of secular trend. Recent increase in non-communicable diseases is example of secular trend. Guys, what is seasonal trend? The change of disease according to season. What is secular trend? The change of disease pattern among many years, after many years. So secular trend is the best answer here. Cyclical trend is after 3 to 4 years, like the measles is coming back. Whenever the immunity among the people goes down, the cycle of the measles outbreak comes. So the best answer here is secular trend. A newborn presented with patent ductus arteriosus. Guys, patent ductus arteriosus, prematurity, cataract. So here the best answer is rubella. This is a presentation of congenital rubella syndrome. Congenital rubella syndrome. In the congenital rubella syndrome, what we see? In congenital rubella syndrome, there is a cataract, sensorineural hearing loss, and heart defects. If I talk about heart defects, then patent ductus arteriosus is common. So here the correct answer is rubella. MDR TB is defined as resistance to. So guys, whenever there is isoniazid, only resistance to isoniazid is known as H-mono. H-mono, only isoniazid. Then there is a term RR. RR means when the resistance is only for rifampicin. Then there is a term MDR. MDR means when isoniazid plus rifampicin. Now there is another term, polydrug resistance. Polydrug resistance means resistance to more than one first line except rifampicin. So if the resistance is for isoniazid and pyrazinamide, this is polydrug. If the resistance is for isoniazid and rifampicin, specifically these two drugs, then it is MDR. Isoniazid and rifampicin, the correct answer is B. Now resistance to isoniazid, rifampicin and fluoroquinol, this is pre-XDR, and if among them one injectable, then it is XDR. All of two regarding rabies immunoglobulin, except maximum dose is dose near deltoid. This is false. Not given after 7 days of first dose. So guys, immunoglobulins are not given after 7 days of first vaccine dose. This is also true. Dose of human immunoglobulin is 20. This is true. If human IG are not available, then equine they are given. This is also true. So here the correct answer is maximum dose is not given near deltoid. This to be infiltrated. Near wounds. Right? If blood pressure of people tracked from childhood to adulthood, it was observed that those guys, see, this is age 1 and this is adulthood, this is childhood. If I track blood pressure from childhood to adulthood, now if a kid who is having low blood pressure in childhood will have low blood pressure in adulthood. If a kid with high blood pressure in childhood will have high blood pressure in adulthood. This phenomena is known as tracking of blood pressure. This phenomena is known as tracking of blood pressure. Rule of half says, what is rule of half? Rule of half says that half of the population is having hypertension. Half of those who have hypertension know that they have hypertension. Half of those who know they have hypertension, only half of them is taking the treatment. Among those who is taking treatment for hypertension, half of them are only able to adequately control their blood pressure. So here rule of half is this. Now, Asha prompted primary for institution delivery in an urban area of Madhya Pradesh. So guys, if I talk about Janani Suraksha Yojana, we give incentive. And when we give incentive to mother, the incentive is given to mother and Asha both. Why we are giving? We are giving to promote institutional delivery. We are giving to promote institutional delivery so that women do not deliver at home, they come to hospital and delivery is done there to prevent the maternal and child complications. This is the purpose. Now guys, for this purpose, government is giving incentive to the mother and Asha. But the incentive is not uniform in whole of the country, but it is depending upon it is a rural area or it is a urban area. So for rural area, the Asha will get, for rural area, the incentive for Asha is 600. For urban area, the incentive of Asha is 400. So they have given urban area, they have mentioned urban area. So Asha does not get 600 in urban, Asha does not get 600. So rule out these two options. Now, if it is a low performing state, it is a high performing state. This is urban area, low performing state, high performing state. 1400, 1000, 1400, 700, 1400, 700, 1600. So Madhya Pradesh belongs to a low performing state. So the correct answer here is mother will get 1000 and Asha will get 400. Guys, now a big question is which states they belong to. Which states they belong to a low performing state. So Bihar, Madhya Pradesh, Assam, Rajasthan. Guys, from Madhya Pradesh, you know, there is another state which was separated from Madhya Pradesh, Chhattisgarh. Chhattisgarh is also there. Then Odisha, UP and Uttarakhand. Odisha, UP and Uttarakhand. Right? So these states are, and which state was earlier in Bihar? Jharkhand. Right? So these states are low performing. They have mentioned Madhya Pradesh. So the better answer here is C. Green color in triage. Green color in triage is for ambulatory patient. They are also known as walking wounded. So the patient who have wounds but still they are able to manage it, still they are able to walk. A case of RTA was presenting to emergency room. Disinfectant used for blood spill. Guys, if there is a blood spill, then the disinfectant used is sodium hypochlorite. It is advised to clean the area with blood spill using sodium hypochlorite. Now there is a question which was asked, which is the first step. So whenever there is a large spill on the floor of blood, the first step is using tissue paper or newspaper soak blood. This is the first step. These two questions come from this topic frequently. First step, soak the blood. Second step, wipe it using sodium hypochlorite. Under ESI Act, sickness benefit for tuberculosis. So guys, sickness benefit under ESI Act is 91 days, but there are certain diseases where the sickness benefit is not given for 91 days. They can avail up to 2 years, like tuberculosis, diabetic coma, cancer, all of these diseases. The sickness benefit is for 2 years. Which phase of disaster cycle focus on minimizing the impact of disaster and involves action to be taken to avoid or reduce the likelihood of event? Guys, I want to tell you about the disaster cycle. So there is an impact. So disaster was there. After disaster, response, we give our response, right? After disaster we give response. So just imagine there is a disaster. As a doctor, you got a call. What will you do? You will go there. This is known as response. And main purpose is to rescue, to triage and to treat. आप ढूंढेंगे लोगों को, आप रेस्क्यू करेंगे, आप उनको ट्रीटमेंट देंगे. आफ्टर सम डेज, rehabilitation. Rehabilitation means now their homes are disrupted. You will give them food, you will give them shelter. This is rehabilitation. In the response phase, as a doctor, you are responsible for giving the care like pain management, like wound management. You will give all of these painkillers, you will give surgeries and trauma related. In rehabilitation, the care as a doctor, rehabilitation phase is around 7 to 10 days after disaster. In this, duty as a doctor is, because now the cases of fever, gastroenteritis, vector-borne diseases, they will increase because of poor hygiene. So this is rehabilitation. And then as a administrator, the job of government is to do the reconstruction, to reconstruct their homes, to reconstruct all the resources, the roads, everything. This phase is technically happening after disaster. And now once the reconstruction is done, then comes mitigation. What is mitigation? Now I am reconstructing building. I should keep in mind to build this building earthquake resistant so that it never happens again. This is mitigation. What is mitigation? Doing steps which minimizes the impact of disaster. And then we have buildings. Now we should do preparedness. Preparedness means we should be prepared, we should be alert. If we get an emergency call, every system is in place, like ambulances, like fire brigade, all of these systems, they are in place. So there is one question which they frequently ask: mock drills. Mock drills are part of preparedness. It is not a part of mitigation. The part of mitigation is building resistant, earthquake resistant buildings, right? Now this phase is usually done before disaster. So the correct answer here is mitigation.